Great. Well, Danielle, I'm
Uh,
happy to see you.
Same, Grayson.
Um, yeah, so tell us like what drew you to specializing in infertility?
Yeah. Kind of many paths up the mountain. I was first really drawn to the infertility, reproductive mental health side of things, working in a hospital. Right out of grad school, as a very early career social worker, I was working on a maternal child health unit. So, kind of the after delivery process. And there, was also kind of first responder for those who experienced loss. So couples, mamas who were coming in with stillbirth or
Hmm.
other complications with the delivery. And so there to help process, memorialize that experience and allow for some grieving. But it drew on my heartstrings, especially seeing how families who had experienced infertility and then coming to this point of loss was such a challenge. And then on the other ward, the other side of things, those who'd gone through infertility and the excitement, right? How joyful and wonderful it was to bring this little one into the world and have that journey
Yeah.
successful. So seeing both sides, it really just piqued my compassion and my interest and sent me on a deep dive into the world of infertility. So then connecting with the American Society for Reproductive Medicine and the mental health group within that organization. I connected with Sharon Covington, who she writes like the Bible of fertility. Uh, well, I don't need to show you, but the infertility counseling. Um, and I took a 10-month post-grad course with her and Linda Burns, and that just opened up my eyes to this full world of assisted reproduction, right? Not just IUI, IVF, but also bringing in donors and surrogates, and just all the complexity and really the village that it takes sometimes to bring these families to fruition. Um, and in working with intended parents and then the donors and then with gestational carriers and surrogates, really understanding more of the identity shifts that happen during this process, really wanting to know more about what happens in these relationships and the attachment dynamics. How is it that couples are successful? How can we build them up to be more successful? And that took me into deciding to go back to school for a doctorate and really honing my research, my dissertation research on what is it, what is it that we can do to shore up couples in the infertility process that not just keeps them supported and persevering to getting to their goal, but also then how can we translate those skills to benefiting the transition to parenthood, so that those relationships don't struggle in the way that most relationships do
Hmm.
in that transition to parenthood.
Well, because a lot of people just believe that they need to like be happy or just grin and bear it or could always be worse even, I imagine. I mean, what are some of the other things that your research found that they're doing or saying or
Yeah, well, I mean, that's a big push that has been a big push in the field for probably the last 25, 30 years, right? Is really looking at the impact of stress on successful pregnancy and then the weight that that puts on, caring partners and the partners who are supporting them, to stay positive, right? Like
Hmm.
be maintain your stress levels, keep them low, do all the meditations and all the things. And those are wonderful and so supportive, and also only half the picture. Right? This process is incredibly painful. It's fraught with grief along so many parts. Grief and then celebration, right? It's the seesaw.
Yeah.
Um, and so in my research, what we're finding is that yes, being positive is wonderful, and that there's so much evidence showing even with that, there's depression and anxiety that comes up. There's relationship struggles that come up, and turning a blind eye to those, is part of what kind of puts the added strain on relationships so that they
Hmm.
discontinue treatment, right? They don't get to have the family that they want to have.
Yeah.
So really trying to find ways that how can we not deny that those aspects of this fertility journey are there, but how can we support? How can we strengthen relationships to make this unbearable bearable, so that
Yeah.
you can stick with what you're really wanting.
Yeah. Why do you think people turn a blind eye? Or like they just kind of suffer
Yeah.
in silence? Like, what's your opinion on that?
Yeah. There's a few different things, right? Like I think that there's a lot of people don't know how to show up and support those who are in pain, right? And
Hmm.
so then if you are in pain and you are looking for support, but the people who are wanting to support you don't know how, then you're in pain and having to take on their pain too. And that seems even more unbearable. Or if, like within relationships, that there's an expectation that if my partner's in pain, then I have to be the one who holds the hope, or I have to be the one to stay positive for us both. But then
Yeah.
that can create a bigger disconnect, and it leaves both partners feeling like lonely islands in this process when we just are wanting to bridge and travel it together.
Yeah. Well, it becomes like one person who needs help and one person who's like helping, you know?
Yeah. Yeah.
And so then what's like the downstream effect of that dynamic where there's like someone, both people are certainly hurting, right? It's not like one
Yeah.
person's, it's not even like a hurt competition. Like it's not like who's
No.
hurting more. The answer is both of them. But
Yeah.
like,
No, it makes sense though. Right. So
yeah,
it's the kind of we're thinking emotional labor, right? It's
yeah,
delegated emotional labor. One has to do all the heavy lifting, and the other is it's I have an image coming to mind of like rock climbing, right? So you have
hmm,
one person who's trying to climb up and like set the pins and have the belay
yeah,
points, and then you
yeah.
have the other person who's got all the gear that they're trying to like pull up with them, right? And so they're each trying to make it up this mountain, but they're holding
That's
different
a,
tasks.
so
Yeah.
it's like a divide and conquer then. Like that's where a lot of
Yeah.
couples get to is just how do you eat an elephant? Just one bite at a time and like you do this part, you all do
Yeah.
that part.
Yes. Yeah. And I don't think so intentionally, right? Like these divides
Right.
kind of develop. And I think the way that our clinics interact with patients kind of exacerbate that divide a little bit too, right? Undoubtedly, one partner has to do far more of the medical treatment, the procedures, the tracking of cycles. Like there's so much more logistics that one partner holds than the
Hmm.
other. And I think clinics become very focused on the one partner who's navigating those logistics. Um, and what's amazing is that, in the research 10 for the last 10 years, in the psychosocial research within infertility, we've been focusing on the unit, and yet that's not translating necessarily
Hmm.
into um, intervention as it
Yeah.
is now.
Yeah. So then that lends itself towards one person who's kind of holding down the fort, the other person who's going through the treatment. So they divide and conquer and they're just in survival mode. And
Totally.
like the clinics are relating to the patient, they're working with the patient needs support, so their partner's there to support them. And then like what happens down the line? Like how long does this
Yeah.
go? Like a year, 3 years, 5 years, or is this like a never-ending thing?
Yeah. Oh, I mean, it can be insidious, right? Like it's a slow creep in the divide, and it's
And it's
hard
so
to,
necessary initially too.
it
It's like,
is.
yeah.
Yeah. Yes, right. Just I mean, that's bringing up all the other patterns that we develop that are necessary in the moment, but that in the long run get
Hmm.
in our way, right? So we have the conquer and divide. You guys, as a couple, they've worked so hard to get this, baby, to have these babies, this family, and there's still kind of this approach where in the conquer and divide, both partners have felt very misunderstood or underappreciated, right? That the partner who has been that trailblazer, who's been holding the hope, holding on the fort, right? Feeling that their work is under not acknowledged or not having any space for their more challenging grief, their sadness about what all has been going through too. And then you have this other, the other partner who's gone through so much and who has held so much of the pain emotionally and physically, and feeling that their partner doesn't see or understand or validate it. And
Yeah.
that's a pattern that can carry into parenthood, absolutely.
Well, totally. I mean, it's like,
Yeah.
I don't know if you've heard this analogy before, but like it's like a little kid carrying a bunch of shells on the seashore. and they
Yeah.
can't grab anything else and they're like so stoked about, this next shell, but they already have so much,
Yeah.
and so it's
Yeah.
like the same thing here in the relationship, right? Like each partner's carrying so much that
Hmm.
when you add on all the to-dos, the logistics, the stress on
Yeah.
the body, even in that postpartum phase, like
Yeah.
there's so much that is still yet to be done.
Yep.
And so you're saying like in the research that shows that like couples just kind of fall back on like what they've typically done, like what worked before.
Hmm. Hmm. Yeah, and that falls in line with communication strategies. One of the big areas of my focus was on dyadic coping, right? So how are couples navigating these challenges together, right? And there's these positive strategies as far as how they delegate, similar to what we've been talking about up till now. And then there's also strategies around communication, but how they give and receive support is
Hmm.
another big one. Overall, what we're seeing is that couples who, and this is for those who've gone through infertility and not, but those who have more of the positive dyadic coping strategies, how they share the struggle, and
Yeah.
less and fewer of the negative strategies or the criticism, the minimizing, those
Probably even
behaviors.
advice giving. Maybe it's those other
Mhm.
things in the worst moments. In the best moments is advice giving, hold down the fort, we can do it, got
Yeah.
to keep going.
Yes,
Yeah,
yes, yeah. Right, which as optimistic as that sounds, it's also very minimizing. So it
totally.
totally falls into that. And so that balance really is what helps predict a stronger marital satisfaction level in that transition to parenthood. It's also what helps, excuse me, it's also what helps keeps couples together and persevering through year-long journey, right? Like years
Mm,
of infertility and treatment. There's one study that comes to mind where couples who were looking at 7 to 8 years of infertility treatments, right? This is active treatment. I mean, we're talking 10 cycles, just a lot of
wow.
intense treatment.
Wow.
But regardless of the outcome of their infertility, couples who were able to endure that long and stay connected, um, they identified strengthening their relationship through that process. It is a little bit of a chicken and the egg, right? Is it that
Mm,
couples who are strong can endure and come out the other side feeling positive,
right,
regardless of outcome, or is there something transformative
right.
and ways that we can support couples in staying connected and strengthening that relationship to get to the outcome that they
Are
want?
there are there any other predictive factors that lead to that? Or like other either character dynamics or capacity issues? Capacity being like,
Mhm.
you know, individual, like within the psychology of an individual that they can hold
Yeah.
complex ideas or conflicting emotions or traumatic experiences.
Yeah, so there's a lot of what's coming up as far as like the dyadic, the couple themselves and
Yeah.
how they're navigating. It has to do a lot with complementary styles. So we're looking at attachment styles that are complementary, right? So what's interesting is, there's a lot of information about insecure and secure attachment, anxious attachment,
Yeah.
avoidant attachment. And the couples who fared most connected were either anxious, secure, or anxious, anxious, right? Because when I'm
Oh,
anxious and you're
uh-huh.
anxious, we're equally anxious about this really hard thing. How seen and
Right.
validated and together are we in this?
Yeah. Yeah.
Um,
Like
which,
you're in the same boat type of thing. Yeah.
yes, and we feel this intensely. You see my pain, I see your pain. Like this is hard and we can do this together. So we're looking at how complementary the strategies are, and that goes for communication as well. So you're looking at those who are more assertive in their communication, kind of need driven, and those who can be more receptive and collaborative, that those tend to work much better as well.
Hmm.
Um, and then
Yeah,
comment,
so you
so
don't necessarily,
yeah,
oh, sorry, go for it.
no, go ahead.
Well, I was gonna say, so it's not necessarily bad news even for a relationship if they don't even have, I don't want to say that, but like if they don't identify as having secure attachment, like that's not a relationship ender by any means. Like even
No.
having some sort of parallel process or shared experience, I should say, like
Yeah.
that can also facilitate this dyadic coping. Because it's about
Yes.
being together, right? I mean, while
Yes.
while you're dividing and conquering all your tasks and to-dos and the
Yeah.
stress and like the social pressures and all the messages that society gives,
Yeah.
the clinic is giving,
Yeah.
parents, friends,
Yeah.
in-laws, whoever it is also giving.
TikTok.
It's about
Yep.
how that relationship is able to bear
Yeah.
that together.
Yes. Yes, absolutely. And it doesn't, kind of as we've been talking about, it doesn't have to be same. I think a lot of our couples come in like, well, I do it this way. Why doesn't my partner do it this way?
Yeah.
And actually it's not about sameness. It's about how does it complement? How do you guys fit
Yeah.
together to make it stronger?
Yeah.
Um, which
Well, and in
is
my practice, I see a lot
hopeful.
of like advice giving where
Yeah.
it's like he or she just needs to believe this, from the other
Yeah.
person. It's like, why don't you see this in yourself? I see it in you,
Yeah.
you know,
Yeah.
but that's inherently dismissing too.
Yes.
And
Yeah.
so but what you're saying though is that's like an entry point where people start to like carry things individually, like on their
Yeah.
own. They
Yeah.
stop going to their partner.
Yeah. Yeah. And when we look at supportive dyadic coping in particular, for if we're talking about heteronormative couples, and we're looking at right the woman being the one who's carrying most of the medical treatment to be the carrier, um, to be the mother, really, right?
Mm.
That their success of a relationship satisfaction hinges on her ability to feel supported, but also her ability to give support. That was the biggest predictor in positive relationship satisfaction and strong relationship satisfaction during the infertility process was both the woman's ability to give and receive support. But if we're
Wow.
looking at the delegated, right, and what her
Hmm.
partner is always trying to be the hopeful
Right.
one, the one going, she
Yeah,
doesn't
there's
get
like a
to, yeah,
supported and supporter as opposed to both roles for both
yes,
people.
yes,
Wow.
that it can be
Okay.
reciprocal. Yep, yep. Um, which that was like mind opening for me too, because that's such a clear point that we can come in and support these couples in strengthening, um, in order
Hmm.
to kind of carry through that process.
Yeah, and then at this point, like in the journey, like when some of these issues start to surface, like, burnout, fatigue,
Mm-hmm.
agitation, relationship dissatisfaction,
Yeah,
issues related to intimacy. I mean, these are
totally.
all like the signs that people typically say, I need to go see a couples therapist.
Yeah.
But like, what's the research show on the effectiveness of just couples therapy?
So generally, couples are less likely to go during
Yeah.
infertility treatment, and which, if we look at it from a financial stance, a time commitment stance, right, and like just the emotional labor
Another clinic
altogether,
to walk into and yeah.
right, another place to open up all these sore spots, right, that makes total sense, and there can be a huge benefit. Yeah.
Yeah, well, I know that a lot of people get referred to couples therapy, but then the follow-through rate is somewhere between like 30 and 40%,
Yes.
where
Yeah.
a partner will say, either a partner, a friend, or someone in their life will say to them, maybe couples therapy, and only like
Mm.
3 out of 10, 4 out of 10
Yeah.
people, couples, relationships
Yep.
will then take that next step, let alone follow through with like finding the right therapist, doing the therapy, seeing it to completion.
Yeah. Yes. Yes. And working with a therapist who deeply understands the nuances of the identity shifts that come with
Yeah.
infertility, not just parenting, but when your body is not doing what it was biologically meant to do with this partner that you have been connected with and
Yeah.
built this life with, that
Yeah.
totally messes with your mind. And so if you don't have a couples therapist that understands those pieces to it, again, how minimizing and isolating and
Yeah.
emotionally laboring that process can be.
Yeah.
It's a
Yeah.
great point,
Well,
though.
let alone like if someone, I mean, my clinical experience has been is that it's always been a juxtaposed to another couple, another friend, another person,
Mm,
that didn't have any issues getting pregnant
yes.
and
Yeah.
so then there's always this like internal, like, how do my roles in life completely reorient
Yes. Yes.
unwantingly? Like you didn't
Yeah.
sign up for this, you didn't ask for this, you didn't deserve
No.
this by any means. It's not a result of anything that, but
No. Yeah. Yeah.
But people
Right.
take in those messages though. I mean, how it's
Totally.
so hard not to.
It is so hard not to. It's so hard not to. And it's so hard, I think of several clients that I've worked with that in their own infertility journeys have had sisters, family members, right? Brothers and their
Yeah,
families get pregnant and have to travel that journey while holding such pain. And how do you navigate? You feel the joy and you feel this intense jealousy. You feel
yeah,
the love and excitement for your loved ones, and you feel this deep
it's
pain
both.
that
Yeah,
it's not. And I think as a culture, we're not very good at holding both, right? We need some
yeah,
support and help in holding both of those at the same time.
yeah. Well, then
Um,
it probably turns
yeah,
into like the partner still going into,
yeah,
survival mode, or the
yep,
relationship, excuse me, going into survival mode.
yep,
And you have a person who's distressed and a person who's caretaker, and then they get to flip eventually
yeah,
in maybe an
yeah,
ideal sense without
yeah,
having the dyad, right? Is that it wouldn't
yeah.
perpetually just be, supporter and supportee, but
Yeah, yeah, very
yeah.
much so. Very much so. Although I think about it too, like some of the couples that I've worked with, it does kind of get stuck this way because the person who's been the supported role hasn't
Hmm.
really actually felt supported or seen or really empathized with, and then it's hard for this person to switch because they're still fighting to have their needs met. Well, then this partner is like, okay, but when's it my turn? Right,
Yeah,
like, hey,
yeah,
I would like to switch roles here.
yeah.
And so it's helping couples have the language to really, it's not about making sure your partner understands you, but having the frame of how can I show my partner that I understand them.
That's so
How
crucial.
and that's the piece that I think gets missed in the advice giving, of all over.
Yeah. Yeah, Danielle, you and I'd be very rich if we had a dime even, probably for every time in couples therapy someone said, I get it, and then I understand. Those are like words that I like, these are like words non grata, like you can't
Yeah,
say these things in sessions. So,
no, no,
but I
without
mean, but
knowing
that's,
without knowing that
yeah,
I'm gonna say, tell me what it is you understand.
yeah, yes. Yeah, well, and then that's the kicker, right? Is
Yeah.
you ask the partner, what is it that you're understanding? And
Hmm.
then they blank. They're like, I actually don't. If they're honest with themselves, they're like, I'm actually not
Yeah.
listening. And that's such
Yeah.
a hard realization, but it's so grounding because that's the lived
Yes.
experience, right? Is like
Yes.
all this advice giving is just survival mode for
Hmm.
relationships, or even being really positive. Everything's
Yeah.
okay. We're doing great. We're doing
Yeah.
everything we can. So there's nothing to really complain about, and
Yeah.
it's this
Yeah.
really nasty, like avoidant cycle.
Yes. Yeah.
So,
Yeah. Yeah.
so
Well
what are the
intentioned.
other, yeah, well intentioned, right? I mean, without
Yeah.
resources or support, or even
Mhm.
seeing someone do it in a really healthy, grounded way,
Yeah.
right?
Yeah.
Like we need these archetypes in our life, these other relationships in our life to give us the framework. It's so good to see something in live action too.
Yeah. Yeah.
So,
Yeah. Yes. And to have community and not be alone, right? Like I think that's part of the community piece is that then you do have the opportunity to see other couples navigate this in
mhm.
many different ways. So then you can choose, like I saw so and so do it this way, and then we saw it that way. Let's go this
Yeah,
way.
yeah,
What can we
yeah,
do? How can we intentionally work ourselves in a more um in a direction that's more in line with what we're wanting?
yeah. Well,
Yeah.
and in an environment too, right? Where it's not just like side-eyeing someone in a waiting room, you know,
Yeah.
it's actually like knowing their name and talking to them and seeing them and
Yes. Yeah.
having
Yeah.
probably dyadic coping even in those pairs, right? Like
Yeah.
something that'd be
Yeah.
really grounding and helpful there.
Yeah. Well, and what's so amazing that there's all this wonderful support for women in this process. And there just hasn't, not without effort. I mean, there's some amazing groups out there that are really pushing for support of men, but I think that again kind of comes back to some of the clinic focus, is that the partner plays such a huge role, whether it's in the physical treatment or not,
Hmm.
that we got to loop in these partners too. Because one of the other pieces that stood out is that where the male partners in this particular research disengaged, where they were feeling more hopeless, where they didn't have a place for the to be supported, because again, they're in that
Mhm.
supporter role, those were the couples that were more likely to drop out of treatment before successfully having a kiddo. And
Yeah.
that's so heartbreaking because it doesn't have
Yeah.
to be that way.
Yeah. And so jolting for the relationship too, to pick up the aftermath of, gone through X number of treatments at
Yeah.
X number of thousands of dollars of treatment, and the time and the communication and
Yeah.
answering the questions probably relationally. And
Yeah. 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 And then those two are the relationships that were less likely to remain after
Hmm.
infertility treatment. Um,
So this is even
yeah.
like a predictor of long-term
Mhm.
connected, not just like emotional connectedness, but like, would you even go as far as saying like staying together?
I would. So it's different studies that kind of came to those conclusions,
Yeah.
but I think in the grand scheme of things, we can really follow that thread and see
Yeah.
how that makes sense, right? If a couple doesn't know how to navigate these challenges effectively together, to the point where then they're not even able to stay engaged in that treatment process,
Hmm.
I mean, it kind of it follows. It makes sense that they might be less likely to navigate the aftermath, the challenges that relationships are going to have outside of family building.
Yeah.
And that's not to say that's what happens to all couples who decide to stop family building treatments. Um, there's many couples. Again, I'm thinking back to the 7 to 8 year cohort, right? Many couples that came out still feeling that their relationship was stronger for it, even without having kiddos.
Hmm.
Um, but it isn't interesting that that divide can be such a predictor.
Yeah, well, because it has to do with what they do with each other,
Yes.
not
Yes.
what happens to, I mean, does the house burn down, or, do you travel for, live in a van? Those aren't necessarily like
Yep.
things that are going to predict if you'll stay together or not. But what we
Yes.
do know, I mean, especially from the Gottman's perspective, like
Yep.
there are micro experiences that add
Hmm.
up if they're unattended. It's like they ferment inside us, and they just get
Yeah.
bigger and bigger over time. And so
Yeah.
from my perspective, I mean, that makes a lot of sense when you say it that way.
Yeah. And I love how it matches too with so much of the relationship research. And Gottman's so
Yeah.
great at those like micro experiences and noticing just these key moments because they're
Yeah.
so and they don't have to be big, but these
Yeah.
key moments and how they accumulate um,
Yeah.
for the positive or the negative, right? It can go either
Yeah.
direction and how these key moments shift relationships.
Well, which is good news for a lot of relationships
Yeah.
because, then you're not
Yep.
stuck in like this hopeless cycle,
Yep.
of
Yep.
unsupported and supporter.
Yeah.
I mean, how long could you hold on to that? I mean,
Yeah.
that's a heavy ask. So that makes perfect sense why someone would look at themselves, X number of years, months, whatever, into the process
Yeah.
and say, this isn't sustainable,
Yeah. Yeah.
so much emotional energy, so much difficulty,
Yeah. Yeah.
disconnection,
Yes, definitely. Well, and then
anxiety. Yeah.
coming from the emotionally focused therapy direction too,
Yeah.
as we look at the split and again that really beautiful intention, right? About this, these are the strategies that we're putting in place to survive this incredibly challenging situation. But it's
Yeah.
also rooted in strategies that have been used in the past, right? And when we can understand that about our partner and have that understood about us by our partner, man, that can put a different lens and a whole level of connection and compassion
Yeah.
on this survival strategy, and then give such a clear path towards intentionally changing those interactions, right? Like it doesn't have to be this. How can we show up for each other
Yeah.
this
Like
way?
it's us, like we're in it
Yes,
together. Yeah.
totally.
As opposed to like a
Totally.
you, me.
Yep. Yep. Very much
So what
so.
would you say the biggest challenges that couples are faced with working through infertility?
Yeah. Yeah. Well, so I mean, if we put the financial piece to the side because there's so much legislation coming out in support of family building as far as insurance coverage. And so hopefully we're working in a direction of some of the financial barriers kind of being put behind us. I think a lot of the challenges come in some of the misconceptions about fertility treatment, either being like a for sure thing,
Mm.
because really it's about how do we navigate the uncertainty.
So, Danielle, like, what are some of the biggest emotional challenges that people are faced with while they're going through infertility?
I think if we were to distill down to kind of the common thread, it's really around having parts of our experience kind of detached, right? There's a lot of pressure to be positive, to be relaxed, manage your stress. I mean, there's so many
Yeah.
apps out there with fertility specific guided meditations and all the things. But in that, it's we're disenfranchising very human experience of grief and anger and some of these more challenging emotions. And when we're not able to experience all of that, then we're in this very split experience internally. But then that shows up in our relationships too, right?
Yeah.
Because when one person, usually the one who's undergoing more of the medical treatment, is carrying the anger and the pain and the grief and the frustration, then there's this pressure on the partner to hold the hope, to be the optimistic one, to kind of keep us moving
Yeah.
forward. And that creates such a disconnect between the two because no doubt this partner is feeling pain and frustration and grief and anger,
Yeah.
but can't let go of the hope because if they let go of the hope, then who's going to hold it? So this
Right.
disconnect leaves both partners feeling pretty isolated and lonely. It can lead to some hostility, frustration, conflict between. There's
Yeah.
rates of conflict are another big predictor of kind of successful outcomes and treatment, and more just because of durability, right? Those in
Yeah.
conflict are going to less likely endure to completion. And so our goal is if we can really help these couples see each other, see their full experience internally,
Yeah.
they'll be stronger, that are able to roll with all the uncertainty that comes with fertility treatment. And then to parenting as well, into all the uncertainty that comes with early parenting.
Totally.
It's a whole other
Totally.
box of worms. I think the clinics are really invested in positive outcomes. They want these families to happen as much as the parents do, right? They want these little ones to be brought into the world. And I think that they operate from a place of remaining hopeful, that that's their advice as well. In part because they don't have the resources to really unpack the grief and the
Yeah.
anger and more of those pieces. Um, and if they don't have hope, then what are we all doing here, right? If the clinic doesn't have hope, then there's no point in continuing forward. So I think that they get pigeonholed into only being hopeful and optimistic. But
Mm.
again, then that leaves the couple, that leaves the partners feeling very misunderstood, or like, what's wrong with me that I don't feel hopeful? That's a whole
Yeah.
other layer that comes out.
Yeah. Or like, why is this so hard then? Yeah.
Yeah. Yes. Yeah.
Yeah.
Big time.
Okay.
Yeah.
So if someone's listening or watching or consuming right now and they're working through infertility with their partner, what's one piece of advice you'd give them?
Yeah. I mean, what's coming top of mind is to be seen, right? It takes risk to really be seen. And so when I say allow yourself or take the step to be seen, it's being able to see the complexity within you and then sharing that with each other and being able to the big okay, there's something coming, but it's fuzzy at the moment.
Yeah, you're doing great.
No, it's more okay. So I think my biggest advice is to have confidence and faith in your relationship enough to lean on each other, right? This is a really hard thing.
Yeah.
And that if that's not a confidence or a trust that you have right now, there's so much support and there are ways to get you there. That's
Yeah.
what I would
And help
say.
it and
Yeah.
like even allowing your relationship to be in the same boat. I think that that takes
Yeah.
a lot of risk and that takes a lot of,
Yeah.
you know, I know it's really vulnerable, right? To
It
like
is.
acknowledge that both of you are really going through it and
Yep.
not for it to be something that we have to iron out, something that we have to solve, something that like is going to go away once this whole process is over,
Yeah.
but it's about just being together.
Yeah. So beautiful. Totally. Totally. And you know, the other part that's coming up is that you're not alone in this. That there are other couples going through this, and that's not to minimize your experience of the pain, but
Yeah.
more that there's support in other places. When I have had moms who've connected or women connect with other women going through infertility and then their spouses meet, right? And then you have this group who kind of gets it
Yeah.
and they can celebrate each other's joy even when it's not their joy because they've known the pain that these friends have had too.
Yeah.
And it's just a very different experience. So
Yeah.
finding
Well,
your tribe, like you're not alone in
yeah,
that as
exactly.
well.
Tribe.
Yeah.
I mean, I'm reading Sebastian Gunger's Tribe right now,
Mm,
and he was a wartime reporter, and basically he found that the military during like the war in Afghanistan, and he found that like when soldiers were able to like collaborate together, which is like what the whole VFW is about, by the way, but like
yeah.
work together, and probably the same for other forces in society, like
Hmm.
I think of LEO or fire or first
Yep.
responders or therapists,
Yep.
teachers. I think there's something human about this when we are just with people who are like us
Yeah.
and then
Yeah.
having resources around us to like not just bear burdens, but also like maximize and really push it out for celebration and
Totally.
enjoyment and being able to hold all of those complex pieces together.
Totally. Yeah.
Yeah.
As you were talking, I was just thinking back to a couple that I worked with where the male partner, the husband had connected with another husband whose wife had gone through infertility, so they were a little bit
Mm.
ahead. And for him to have somebody who understood what the mood swings were like,
Yeah. Yeah.
right? And but not in a judgmental way, but could really understand like my wife's body is going through so much with all of these injections, and I'm trying to be
Right.
there, but some of this stuff is wild. And to have
Yeah.
somebody else who was like, it gets better, right? I've been there, like this
Yeah.
happened.
Yeah.
Just it's so healing. It's so healing.
Yeah. And especially like with all these unknowns, I mean, there's not other life circumstances that are similar to this
Yeah.
process. I mean,
Yeah.
it's really hard to find transferable skills is the word that comes to mind, but like,
Yeah.
parallel experiences that you could draw from.
We're in a society where it requires two incomes for most couples to feel comfortable taking that next step towards bringing a baby into the world. And then by the time that they do that, right, there's all of these biological shifts that we've been told, don't worry about it, right?
Yeah.
Like you can have it all. And
Yeah.
then to be faced with the reality that there's challenges is really painful. Yeah.
Yeah. And then the cherry on top is that there's not other people around you that
Yeah.
see that you have challenges.
Yes.
Yeah.
Yes. Yep. Yeah. And then the clinics that are saying, like, don't worry about it, just be optimistic, be hopeful.
Yeah.
Yeah, there's all these layers of like pulling away from the anger, from the grief, um,
Yeah.
of the reality of the situation that these couples are navigating.
So this is really important because it's not just about how you relate to your partner long term, it's also important about how you relate to your dependents long term too.
Yeah.
Because if you have all these unresolved feelings about how your dependent came into the world and the pain and the problems and the social pieces and everything that infertility brings, if
Yeah.
that's left unresolved, I mean, you got to think that that's going to come back up later.
Oh, definitely. Definitely. Right. That's the beauty of attachment. All those experiences in fertility are tied back to our own attachment
Yeah.
histories as well. Right. And
Yeah.
so here to the current, to the future, it all just
Yeah.
cycles its way back through. So
Yeah.
again, if we could look at the cycle now, how beautiful, what an incredible gift to be able to
Yeah.
shift that pattern for the future as well. So again, we can move forward with more intention in our romantic relationship and our partnership, but also with future generations.
Yeah,
That's a whole other
awesome.
topic, Grayson. I could
Yeah, seriously.
totally like geek out on
Yeah.
that too.